wondering about long-acting injectable medication? Well then, you have come to the right place, my friend. What is a long-acting injectable medication, might you ask? Well, a long-acting injectable medication, often referred to as depot medication, is a special preparation of a medication formulated to ideally release slowly, continuously, and constant sustained release throughout the body. This continuous release depends on the structure and polymer formulation and characteristics of the drug. So, how do you get them? You get them in an injection into your muscle, so a deltoid, ventral gluteal, vastus lateralis possibly. You know, anywhere you have a good muscle, it's vascularized. Why would you use them? Many patients find it hard to comply with their medication. Who wants to take a pill every single day? We all lead busy lives, let me tell you. So, with a long-acting injectable medication, how often do you get them? It ranges from every week to every 3 weeks, every 4 weeks, depending on your medication and the use for it. So, many patients find it easier to get one injection every 4 weeks instead of taking one pill every single day or multiple pills to get the right dosage. So it can increase patient compliance, decrease frequency of administration, and create more stable levels of the drug within the body because it decreases the difference between the peak and trough plasma levels. What are the bad sides, you ask? There's always a catch. Might hurt a little bit. It's a little poke right in the skin. You can't do it yourself. I do not recommend this. Please go see your healthcare provider. So it means you got to go in to see your healthcare provider, get your thing. So if you're out of town, you got to plan that, or you got to see somebody. So that's a little tricky. And the other negative is that when you begin them, you may have to have a loading dose and then in a week get another dose just to get the levels maintained, or you may have to stay on an oral dosing while you start the injectable medication. So I'm here with my client M, and M has a diagnosis of psychosis with a history of schizophrenia. Is that right?
That's gosh darn right.
Okay, well I have your MAR here. I'm just going to ask you anyways because it's kind of nurse I am. Like, what kind of medication have you been on for this?
Abilify.
Abilify. Mm-hmm. That is also called Reprisol. Did you know that?
Oh, yeah. They never were able to pronounce it.
Oh, okay. So this is what you take every day?
That is correct.
This oral?
This
medication?
oral, yeah. It's a pain.
That looks like a pain.
Mm-hmm. Look at all
that.
Every day.
Every day.
Mm-hmm.
Okay. Do you find that it helps?
Yeah.
Yeah?
Keeps me pretty level.
Are you able to take these every single day?
Sometimes I miss a dose or two.
Oh, why is that?
I just forget, or I have things to do, or I'm at a friend's house or something like that.
Okay. Mm-hmm. Okay. Well, then, have you ever been discussed long-acting injectable medication?
What is that?
I have this same medication.
Okay.
Get rid of that. Into a needle. Get rid of all those. Into a needle. And you only have to get a shot of this every 4 weeks.
Every 4 weeks?
Yeah, so you can do whatever you want. Well, within limitations. Mm-hmm. For 4 weeks, you just got to come back and see us, and we'll give you a little poke in your deltoid, or more preferably your ventral gluteal muscle, where it's more vascularized to absorb this intramuscular shot. And then you'll be getting your medication.
That would be so handy.
You think you'd be up for that?
I think so. I think we should give it a shot.
Alrighty.
A shot.
We're going to give her the shot into her deltoid muscle here. I'm just going to do some landmarking for educational purposes as on why I'm using a pen. So I'm going to locate the acromion process right there, I think. I'm going to go 3 fingers down from there. And then I'm going to do an upside down triangle. And this is her deltoid. A nice muscle in the arm, upper arm, but I'm always taking into consideration the center of mass for my patient. So it's a pretty good center of mass right there for her, but I might go just a little bit over in my little triangle. So don't always follow gang signs, kids. Landmark, landmark, landmark. M is ready to get her long-acting injectable Abilify shot. It's already drawn up in its own syringe, ready to go. We've landmarked, so I know where to go. We're going to swab the site, inside out, clean as a whistle. Are you ready for this? It'll just be a little poke.
Okay.
Hello again. We're here with Em, 4 weeks after she's begun her long-acting injectable form of Abilify medication. I just wanted to ask her how she's doing to, continue my nursing process evaluation. Em, how are you doing?
I feel great. I feel my symptoms are well balanced or well controlled, and I have a lot more freedom now.
Oh, really? Why so?
Because I don't have to take a pill every day. Once a month.
Once a month? How are the injections? Are they painful?
They are they're a little good poke, but it's worth it.
It's not bad?
No, yeah.
You think you could do it every 4 weeks?
Oh yeah, for sure.
Long-acting injectable medication, people.
Closing time! Long acting injectables!